Our guest today is Dr. Oluwadare Adepetu. He's the Chief Medical Director of Novel Hope Medical and Fertility Center. And today, we'd like to begin by talking about issues around fertility. Let's go from the top. So, what is infertility?
Thank you. Infertility, simply put, is the inability of a couple to achieve pregnancy after 12 months of unprotected sexual intercourse. That's infertility.
Okay, so if people have been exposed to unprotected sex for 12 months and they don't have babies, they are considered infertile.
Yes.
Okay, we've heard stories, especially by mothers, saying that sometimes they just don't know the right time to do it. How do you reconcile timing to the inability to have babies?
When we say couples that have been together for 12 months, we're not talking about people that are living apart or married. We're talking about people who have the desire to have babies, to achieve pregnancy. So that means these people must have been living together, and there is what we call adequate sexual exposure. A woman is considered to be having adequate sexual exposure if she's having intercourse on at least 3 times in a week on alternate days. That's when it is said that a woman has had adequate sexual exposure. So if a woman has been having this for in the last 12 months and there is no pregnancy, that's when such a woman is considered infertile.
Oh, thanks. And in recent times, there's been an alarming rate of couples without babies. The rate of infertility seems to be climbing by the day. What would you say is responsible for this?
Yes, so many things can be attributed to the cause of the increase in the rate of infertility that we are witnessing now. The cause or the cause of infertility varies from one geographical location to another. In different climes, there are different things that are responsible for couples not being able to achieve spontaneous conception. Now, in the developed world, what is responsible for their own is different from what is responsible for infertility in our own less developed world. Now, the causes of infertility in the developed world range from voluntary infertility, in which people choose not to have their own babies, probably because they want to pursue their career, they are just not interested in having children. Unlike in our world, where when a woman gets married, then the next few months everybody is expecting her to be pregnant. So because we place high premium on childbearing in this part of the world. Then another thing that can explain so the different cost, what is sorry for infertility in the developed world is different from ours. In our own area, there is the leading cause of infertility is the infectious causes. Infectious causes in the sense that there is liberal sexual behavior, but we don't have the requisite medical backup to treat all this resulting infection from the liberal sexual behavior of our people. And the health-seeking behavior of people in this part of the world is another thing that is responsible. It's very poor. People who have infection, people who are sick, they don't go to hospitals, they go to medicine store to buy drugs, they get suboptimal treatment, and most of these organisms become, they are not completely treated, they go subclinical. Subclinical in the sense that the patient is no longer manifesting the symptoms, the body is no longer getting out, there's no discharge, there's nothing. So the woman feels she's fine, but the organism has gone underground and is causing damage in them. Another reason that we can attribute to the increased cause is probably there is increased awareness, there is increased medical facility to make diagnosis in our world now. So many things that were probably put under unknown in the past are things that we can actually establish as causes of infertility these days. So those are things that could probably have accounted for the increase in the rate of infertility. Not that the infertility rate has increased, but there is increased awareness. We now detect more cases, unlike in the past that we don't even hear it. People don't come out. People are ashamed to come out and
This is Goshen TV, broadcasting independently from Port Harcourt, South Nigeria. We've come into the global media space to take a prime place to do the business of journalism and broadcasting in different and exciting ways.
On our platform, you will watch breaking news, special interview programs, for example, the Pandora Box, Stars, News Digest. There will also be Gist Hour and many more.
Goshen TV will offer you a platform to advertise your goods and services, as well as provide the opportunity for the coverage of your special events. To enjoy our various programs, follow us on YouTube, Instagram, Facebook, and Twitter. Goshen TV. This is The Tonic.
Welcome back. Okay, so you talked about poor response, poor attitude to healthcare. Don't you think that's as a result of the cost of healthcare in this part of the world?
When you look at the cost of healthcare in this part of the world, just like you are trying to put it on the cost of treating people. Now, when they go through this other route of going to buy drugs, getting some clinical treatment, eventually coming to the hospital, they spend much more than they would have spent if they come directly to the hospital. So the problem may not actually be the cost.
Okay.
It might be the awareness or the belief of people. Now, if you go to, permit me to use this word, prayer houses and all that, if a pastor offers prayers that you buy car, you say, push shouting, amen. And if they pray that you will not go to hospital, they're shouting, amen, not knowing that you need good health to drive the car. So it's the attitude of our people, the health-seeking behavior is very poor. It's not necessarily the cost of healthcare because they pay much more.
At the end of the day.
So
you're saying it's penny wise and pounds foolish not to go straight to hospital when you have a problem.
Permit us to use that word.
Okay, that's fine. So apart from infections, what else could be responsible for infertility?
Now, if you look at the infertility generally, when there is an infertile couple, people tend to say it's like we live in men's world in this part of the world where there's a couple they are experiencing infertility, they think it's the problem of the woman. No. When you look at the causes of infertility, it's 30% that of the fault is 30% with the men, 30% with the women, 20% the two of them combined. Then there is 20% that remains unknown, that we don't know the cause. Now, of the 30% for men, the leading cause will be poor semen quality, that's poor sperm quality. Some of them don't even have at all, some have low sperm count, some have poor cells. That's one, and there are so many things that can cause that. Now, when it comes to the women, it could be under uterotuber factor. Uterotuber factor simply means factors that has to do with the uterus, that's the womb, and the fallopian tubes. Now, if there is problem with the tube, blocked tube, if there is blocked tube, tubes with infection such that it has collected water, that's what we call hydrosalpinges, or if there is problem in the womb, take for instance somebody who has had previous termination of pregnancy in which they have done over-curating of the uterus, and the uterus are resulting from that has now gone together, that's what we call intergenital synecdoche. Then these are some of the causes of uterotuber factor. Fibroid is something that is very common around this part of in this part of the world. That's another thing that can occur in the womb that can make pregnancy difficult. Now that's uterotuber factor. Another another thing that can cause infertility in women is ovarian factor. That's when the woman don't release egg, either because of some medical disorder. Chief of them is polycystic ovarian syndrome, or people with early premature ovarian failure, or those who don't even have ovary from birth at all. So that's our ovarian problem. Now, some of them have hormonal imbalance, which could occur at the level of the pituitary or at the level of the hypothalamus. So these are the causes of infertility.
Well, that's quite revealing. Thank you. So we'll be back shortly with much more revelations. Remember to subscribe to our YouTube channel and like all our social media handles as shown on your screen. See you.